Hi, everybody. I'm Richard Gerhardt, founder of Gerhardt Law, a full-service intellectual property firm. This is Passage to Profit, a show about entrepreneurs, new businesses, and intellectual property.
And I'm Elizabeth Gerhardt. I work in the firm, but I'm not an attorney. I have my own business, which I will talk about later. But we have amazing people. This is kind of a medical themed show today, but with very, very interesting stories and people. So please stay tuned. I'm really excited about today's show. So
Yeah, prepare to get healthy. So what's first on our agenda?
So Trademark Terror. So
I'm trembling already.
So there is a restaurant in Wisconsin named Goats on the Roof. And they wanted to trademark their name. And we'll get into their story in a little bit. And it went all the way to the Supreme Court.
Well, almost to the Supreme Court.
Almost to the Supreme Court. The Supreme Court rejected it, right?
Right. Cert was denied. So for all of you Supreme Court aficionados, if cert is denied, it means that somebody tried to get the court to hear the case, but they said, nah, we're not that interested in it. And they just decided to abide by the lower court's ruling.
So this is really fun. There's these two guys in Wisconsin that have been friends forever. One of them owns a restaurant. His name is Al Johnson. And his friend, Winky Larson, that's not his real name, but he goes by Winky, decided they exchange animals every birthday. So he decided to play a practical joke on
What
Al.
A great friendship. I mean, who wouldn't want to exchange animals? What do they do? You know, the shovels, is it farm implements?
So with the name like Winky, well, picture this guy in your mind. So Winky managed to put a billy goat, horns and everything, under his arm and carry him up to the top of the roof of the restaurant. I don't think Winky really fits that picture, but anyway, maybe it's a joke. So when he got to the top of the restaurant with the goat, as this practical joke, goat was fine, but something happened with Winky and he flew off the roof and cracked some ribs.
I think the goat kicked him. That's what I think. And honestly, if somebody picked me up and walked me up a ladder and put me on a roof, I'd be pretty mad too. So the goat at all.
But there's grass on top of the roof or thatch or something, so it's like kind of nice for the goat. So the goat actually really liked it up there,
I guess.
And so
according to the goat.
According to the goat. So they're like, hey, let's be marketing geniuses. Let's put goats on our roof. People will come from all over because they have a goat farm.
I hope they have a really well-insulated ceiling, for the goat, because we wouldn't want any goat stuff to get down into the restaurant part.
Yeah. I think it's pretty well protected. But if you go on YouTube, there are Goats on the Roof, the restaurant in Wisconsin. They have videos that are just adorable. They have baby goats. They show their farm. It's really fun. One of these days, that'll be on my list, is to go to that. It's a Swedish restaurant in Wisconsin.
Door County, Wisconsin. But you forgot to talk about the legal part.
Well, you get to talk about that. I'm not an attorney.
Oh, okay. So there's this guy named Bank who took these people to court to have their trademark. They got a trademark on the roof, right? As an IP attorney, of course, I would endorse that strategy. But this guy Bank, for some reason, decided that trademark was improper. And so he sued the restaurant owners and filed a petition at the trademark office to have their trademark expunged, right? And so the reason for this, too, is that he felt that having goats on the roof was demeaning to the goats. And this is his legal argument, which unfortunately does not really come into play in any legal theory that I've ever heard of. And quite frankly, if you have goats that are on YouTube, how could that be demeaning? And actually, the goat owners, they are very sensitive and kind to the goats. They they bring them down off the roof every night and they rotate them and they get very well treated and they're famous. So,
well, the goats follow them around like dogs.
Yeah.
If you watch their YouTube videos, the YouTube videos are adorable.
If you're in the mood to see goats on the roof, you should check out their YouTube channel. And so anyway, he worked it through the court system. He took it all the way up to the Supreme Court. And finally, I think the Supreme Court made a decision that just about everybody can agree with, they decided not to hear the case. So the Supreme Court is very controversial sometimes. We all know that, but I think everybody can agree that having the Supreme Court review the Goats on the Roof case would not be the best use of their time. So,
So Goats on the Roof it is.
So Goats. So we can live happily on with Goats on the Roof.
So let's move into IP in the news. This is a very cool story. It's really a cool story if you're a geeky scientist. So back when I was younger, I'm not going to say how old, one of our American geniuses was Buckminster Fuller. His real name was Richard Buckminster Fuller, but everybody knew him as Buckminster Fuller. And you may have heard of him. He was an architect, systems theorist, author, designer, inventor, and futurist. He invented the Geodesic Dome. You may be familiar with that. It's so it's a bunch of geometric forms put together to make a dome, and people live in that and it's kind of the futuristic thing.
So if I can just jump in here. So Buckminster Fuller was famous for coining the term Spaceship Earth. So for example, if you've ever heard Spaceship Earth, he was the one who coined that. And much to our detriment, he also coined the term synergy. So every time you hear the term synergy and you're sick of hearing that word, you can blame Buckminster Fuller. But he invented.
I actually love that word synergy. I think I use it a lot.
This would be so cool for a person, but very few of us get this honor. In 1985, Harold Kroto at the University of Sussex, James R. Heath, Sean O'Brien, Robert Curl, and Richard Smalley from Rice University discovered a molecular geodesic dome kind of structure, and they named them fullerenes. There are a few different structures that fall under this class, but they actually named them Buckminster fullerenes after him. So he lives in the scientific world forever. So people call the most famous one buckyballs. So what's a buckyball?
Glad you asked. No, buckyball, it's like a molecule that sort of has the shape of a soccer ball. And it's carbon atoms that that form this soccer ball type shape. It's like a cage. They act as cages to contain different other chemicals. And so this is new technology. So you could put like an antimicrobial agent in there. So antimicrobial agent is like a chemical substance that would either kill or repel bacteria or viruses. So of course, this is coming up now as a potential COVID treatment. And you could put these cages, these little balls, buckyballs as they're called them, into different materials. So you could put it into cloth, you could put it into plastic.
So for this application that Kepley Labs is working on, they did a press release, so they have a registration number for their patent application, but it isn't public yet. But in the press release, they said that typical masks and garments keep you safe by repelling. They don't like water, so they repel the droplets. What they're working on actually attracts the droplets, and the droplets come in and are murdered by the chemicals that are contained within these fullerenes that are impregnated in the material. So it's a real advance because it helps actually remove the disease from the air. And it works on viruses, fungi, bacteria, everything. So kudos to this
well, that
company.
was a very, very scientific discussion.
We'll be right back. And please stay tuned. We have just amazing people to talk to today, and I'm so excited about their stories. So you are listening to WOR 710, the voice of New York. Welcome back, listeners. You are listening to Passage to Profit, the Inventor Show with Richard and Elizabeth Gearhart on WOR 710, iHeartRadio, the voice of New York. We have as our guest today somebody that you all probably need to talk to. His name he's Dr. Fawad Mian. He's a neurologist and a pain relief specialist, and he also helps people sleep. And he's got some cutting edge technologies that he uses to try to help people avoid surgery, which is so important. So welcome, Dr. Mian.
I'm a neurologist by trade, and I started my own practice about 10 years ago here in the West Orange area. So originally I started out as a neurologist, and I saw a lot of people in pain at the time. And I was treating with traditional medications, traditional injections, and some people would get better, then some people would not. around the same time, I was also having some of my own issues as well. Unfortunately, I already had surgeries in the past for different things, including my knee, which I tore up in med school. And I had it surgically repaired, and it was bothering me too as well. So, my only choice at that point was to, as I, again, maybe getting more surgery or doing some therapy, which I did, but I didn't want any more surgery at that point. At the same time, I also had a shoulder issue, and I was told, you know what, you may need to shave the bone down for that to get better. Like if you don't really need the bones in your body for anything, they're not quite as important as you thought they were. It's a little daunting to hear that from another doctor. Well, we got to shave this down, and when I had my Achilles pain, basically the surgeon was like, well, maybe we shave the bone down too. It might feel a bit better, and then reattach it. That wasn't very appealing to me, so I wanted to look for different alternatives for treatment. And that brought me to regenerative medicine. What regenerative medicine is just basically using your body's own power to help heal itself. And there's a different spectrum with that includes things such as prolotherapy, platelet-rich plasma, and autologous stem cells too as well. So I've been, beginning to, years ago, I implemented a lot of the prolotherapy and platelet-rich plasma into my practice, and I've seen pretty good results for a lot of folks, also including myself. So I was able to avoid surgery. And as we've gone on with things, we've been looking more into diet, nutritional, functional movement, looking at nerves, just to really comprehensively treat somebody and making sure that they're at their optimal health.
You do that first, but if it doesn't work on somebody for whatever reason, then you will tell them you probably need surgery. But this is what you do before surgery to avoid surgery if you can.
Right. And this is basically, an alternative for that. So, as I've told many patients in the past, and, sometimes surgery is needed. Sometimes you really do need it. And there really is no alternative besides that. And I've had plenty of patients like that too. But there are plenty of times when patients are, told, well, it's either these steroid shots or surgery, and that's it. It's really not it. There are really other treatments that are out there that can definitely help those folks to prevent them going to surgery. And a lot of times those surgeries may not even be necessary at that point.
Pain treatments have really evolved a lot over my lifetime, 40 years. But I mean, it used to be most of the pain treatments were really injections, different types of drugs. And now the arsenal has, greatly widened to different types of holistic treatments. Pain, though, is the transference of neurons back and forth between the affected areas and the brain, correct?
You're getting signals sent basically from your body to your brain, and that precedes the pain.
In terms of treating pain, what are sort of the categories of different kinds of treatments that you would look to when you're treating a patient?
One of the most basic things is what you're doing right now. So if somebody came to me and said, you know what, I have had this knee pain for the last several months, and I'll ask them, okay, well, what have you done? Well, I've taken some Tylenol, maybe some over-the-counter medications to help with that, but it's not really helping. And I'll ask, have you done anything else? And a lot of times it may just be no. So the very first thing would be physical therapy, because as you know, a lot of people can just get better by doing physical therapy. Not everybody, but a lot of people can. If it's a simple, cheap, and effective way of making somebody better, then that's great. If they're not really progressing past physical therapy, then there are other things too as well. There's acupuncture that's out there that I do refer a lot of folks to as well. In the insurance-based model, there's also the cortisone injections, which I kind of shy away from to a certain extent as well, because they can also lead to a lot of problems. So there's a time and place for cortisone for various different body parts, but in joints, typically you don't want to put them in because they're catabolic and they destroy joints over time. And those are injections that are done superficially and deeply around the nerve. So sometimes nerves are just caught. So for instance, I'll tell you, I do lots of ultrasonic carpal tunnel injections all the time. So instead of that person going to surgery, I can visualize the nerve underneath ultrasound, and I can go in there with an injection and loosen the nerve and decrease the inflammation. And then for other body parts, like for instance, such as a back, there are different types of regenerative epidurals that can be done. There's also prolotherapy, PRP, and stem cells that can be utilized for that too as well.
From a preventative standpoint, so are there any preventative treatments that you offer people? Say they work out a lot, say they're a weekend warrior, say they're just looking to stay ahead of, being healthy? What do you offer from a preventative standpoint for those folks who aren't necessarily experiencing pain, but are trying to stay ahead of potentially getting hurt?
Yeah, that's a great question. So, and actually it comes down to some very basic things. So, whenever I look at somebody, and these are probably the most basic things you've heard of is, how well hydrated are you? A lot of people, honestly, are not very well hydrated when I see them come in.
Is there a number of glasses of water you should drink a day?
Well, in general, there's that old adage, drink 8 glasses of water a day. But honestly, for some people, they may need more, they may need less. For me, I'm somebody who's had kidney stones in the past, unfortunately, twice, which is extremely painful. So for me, my hydration is like I drink a lot of water, and if I don't drink a certain amount and it's way past 8 glasses of water a day, then I feel dehydrated. My mouth is dry, lips get dry. So clinically, when I look at people, I'll look at things like, what does their skin look like? What do their lips look like? And it's also like diet and nutrition. What are you eating? And a lot of people sometimes think what they're eating is, nutritional. But, and some folks, for instance, they may have sensitivities to things like wheat. May not be like celiac disease, but they may be sensitive to wheat. They may have chronic aches and pains and never know that that's the problem. Or dairy, for instance. So these are just two common things we can. There are also nutritional plans that I'm trying to develop too as well to go over with people. So these are just some very basic things that I go over with. So there's supplementation too as well. So if we can just really get those people to do just some of those few things, that can be really preventative in terms of having those injuries and those pains later on.
So this was one of the questions that I was going to ask you that I don't really want to hear the answer to because I think I know what it is. So you probably tell a lot of people to lose weight, right?
Well, absolutely. I mean, for instance, like if somebody comes in, who has back pain, for instance, they do have a lot of weight around the midsection. Well, we can do all the stuff in the world. We can do injections, surgery, medications, and all that kind of stuff. But if you're not losing the weight, you're not putting less load on your frame for your back, it's still going to hurt at the end of the day.
I just had a question about sleep because I feel like that's really important. I work out often. I try to do the best I can to eat a decent diet, but sleep is something that I feel like myself and a lot of other people struggle with, and I don't get enough of it. And it's a big part of your overall health. So what are some treatments that you offer in terms of people who are sleep deprived? Like I love to sleep when I can, but it's very, it's very hard to shut my brain down.
Well, that's, what you're saying is basically literally like every person who comes to me with the sleep issues, I can't shut my brain down. And, we're in a world where everything is 24/7 now, and we can't just shut the brain off. I'm just going to give you an example of Superstorm Sandy back in 2012. I'm sure everybody remembers that, right? So back then, I still had a couple of insomniacs at the time. Like, no matter what I did, no matter what medication I took, I just couldn't do anything. I couldn't sleep or whatnot. But then when all the lights shut off at, I can't remember, maybe like 6 or 7 o'clock at the time, they were falling asleep at like 8 o'clock or 9 o'clock at that time. So it's just, the light that we're being exposed to chronically all day long from the stuff that's on our phones, from the stuff that's on our computers. We're on these electronic devices all the time, and we don't stop that. And typically a lot of people, I tell them, look, you know what? If you have this problem, shut off everything for at least 2 hours before bedtime. Your bed simply should be there for your sleep, and that's about it. Those are two very powerful things to do. And it sounds so simple, but it's just people don't do that. And so then when somebody tries to sleep, it's like you're trying to fit it into a schedule. It's like, all right, time to sleep. I'm going to go to sleep. But you're still in the mode of work. I'm doing all this work. I'm thinking about X, Y, and Z and all of that. So, shutting that stuff down 2 hours before bedtime, starting like a meditation program is just two quick and easy things that you can do just to start off with that.
Yeah, I've tried sleeping pills sometimes, but the problem with those is they make me drowsy the next day, right?
Mm-hmm.
I tried them a couple of times, but they don't seem to work for me. Do you ever suggest, sleeping medication for your patients?
In general, quite honestly, even because I'm board certified as a sleep physician, I actually try to avoid them for many different reasons. Because I've had people do crazy things on these pills, from wandering down the street with their pants half off, or being on top of a roof.
About that, come on.
These things happen, but people don't really hear about them that much. But we see that. But the other thing is that it becomes a crutch for people. So then when you don't take it, you have severe insomnia. and it's harder to treat. The other thing that happens that people don't realize also is that once they start taking these pills, they develop a tolerance to it.
Mm.
So after a few years, they just stop working, and then they come to, well, what else can I try?
So is that the same for over-the-counter medication, or is that primarily prescription medications? Because the industry does a lot of advertising for medications, and they have all these really awesome pictures of people just nodding off
Knocked out.
and then waking up like they're
Refreshed.
refreshed.
Fresh. I mean, so prescription medications primarily, but, when you look at stuff that's over the counter, for instance, and there's going to be such variable quality to what's over the counter that, the general population can buy. So you see a lot of stuff out there. You'll have things, like active ingredients from Benadryl. You'll see that in there. You'll see some melatonin or some herbal things, and they can be very hit and miss. But again, like as you said, they can make people very groggy the next day, especially like if you take like mega dosages of melatonin.
Yeah, none of it works for me. I've tried everything except medication. So
Did you have melatonin? Did that didn't make any difference? Because that seems to be the big thing.
I mean, I felt relaxed, but like not enough to go to sleep for any lengthy period of time.
What do you think about having background noise, like maybe some soft music that you play all night long, or like a white noise generator? Does that help?
Oh yeah, I love it. I've been using it since college. Now my wife's used to it too as well. So is my son.
So do you use white noise or music?
I use white noise. So I use the sound of a fan. So, a couple of different things. When I was in college, obviously the dorms are extremely loud. When I did my residency in New York, I was basically close to the Queens Midtown Tunnel in Manhattan. So it's really loud.
I have this theory that New Yorkers are especially aggressive because nobody gets any sleep in the city because it's always so.
So what is the most common advice that you give to your patients who come to you?
Well, the most common thing is I really want them to really adopt a healthy lifestyle. And it doesn't involve it doesn't necessarily have to involve pills or prescriptions and things like that. It's really just getting them to make sure, are you taking care of yourself? Are you getting the proper sleep? Are you de-stressing? Are you getting exercise? Are you eating the right kinds of things? That's really what I want to focus on when people come in the office, because that can take care of a lot of ills.
And you have a book, I saw.
Oh.
Yeah, I have a book, which I think, thanks for mentioning that. I did write a book on, it's called Getting to Pain Free, which recently came out a couple of weeks ago. We had it actually on Amazon on pre-release a couple of months prior to that. It was actually able to reach #1 bestseller in several different categories on
I
Amazon.
saw that.
Yeah.
Congratulations.
Yeah, thank you. Yeah, so it takes a little deeper dive into regenerative medicine, into the issues that I've gone through, and gives some dietary advice and things like that, and supplementation. It's a good guide for people to see, well, if I really have these kind of issues, are there other alternatives out there? And I'm hoping, that book will be like a good springboard for people.
Exactly. So we're coming to the end of our time here, but I have a million more questions for you, but maybe we need to talk offline, but, or I need to come to your office, right? But
Sure.
How do people get a hold of you?
Well, they can always call the office. Our number, we're here in West Orange, so our number is 973-928-3288. And you can also get more information by going on to www.polyhealing.com. And there's also our Facebook page as well, which has a lot of content on that, which can be very useful for folks.
Wonderful. Thank you.
Yeah,
Well,
no problem.
Break. You're listening to WOR 710, The Voice of New York, with Richard and Elizabeth Gearhart, Passage to Profit, The Inventor Show, and our special guest, Dr. Fawad Mian. We'll be right back.
Welcome back, everybody. You're listening to Passage to Profit with Richard Gearhart and Elizabeth Gearhart, and we are having sort of a health-oriented program this evening, so we hope you'll find it interesting. And if you've missed any of the program so far, you can always hear it on our podcast, which will come out tomorrow. That's available on iTunes and the iHeart podcast station and wherever podcasts are found. And you can also find it on our website and also on our YouTube channel. So coming up next, we have a presenter. Her name is Kelly Marzoli. Kelly, you have 2 minutes. Go.
All right. Well, first of all, thank you so much for having me. I'm really excited to be here, and it's important that we talk about mental health, especially facing the psychosocial repercussions of COVID right now with isolation. So we started Mental Health Global Network in order to prioritize mental health on an equivalent level to physical health. When our bodies are weary, we're willing to see a doctor, and we receive a lot of social support. So why is it so hard to do that for our brains? And so how we prioritize mental health is through educational programming, and we also created a mental health first aid kit. So we basically noticed that most school systems include physical education and physical health classes, yet we're lacking mental health education at large in our schools. And growing up, I never really learned about it. And I was unaware until I actually lost a good friend to suicide. And that's kind of what put me on the path. I was called to action to do something because so many people are suffering in silence. And so we teach a course kind of like CPR, but for mental health issues, that teaches individuals how to help someone who's struggling, and also how to refer them to professional help, and what does treatment look like. And as we were teaching our courses, we were doing them in person, but due to COVID, now we've brought the course online. We offer it to the public once a week, and then we also plan trainings with companies and schools. And we just kept talking about how we wish we had more tangible resources to give to people. Like, we can give them a link, we can give them, psychologists to refer to, but to actually have something physical to start the conversation about mental health. So we created a mental health first aid kit that has 9 coping tools for mental health issues. And every item in the kit helps ease sensory overload, anxiety, and stress. And basically, it's not a guaranteed solution to mental health issues, but it can certainly start the conversation and normalize these issues. And then each tool can be used as a meditation device as well.
I'm so happy you're doing this. Mental health is obviously a key to a happy and fulfilling life. But how do you define mental health? What is mental health?
Well, mental health is a key component of what makes us well. Just like our body refers to our body, obviously, our mental health refers to our feelings, emotions, and behaviors.
So are you looking, is it happiness, or is it satisfaction, or is it emotional resiliency? How would you describe a mentally healthy person?
Well, our mental health ranges from being healthy to being in a state of crisis. And in between that mental health, we see stress and struggling. Stress is normal. So someone who's mentally healthy can live a fulfilling life, can contribute to their community, and has normal moods, normal functioning in general. It's not necessarily happiness, because that's something hard to measure. And every day is different for every person, and it takes a proactive effort through self-care, as well as working with a therapist. You don't have to have something wrong for you to seek help and to work through, just like being a human being. Like, we all have to figure out who we are, and we have essentially a lifetime to do that. Mental health, positive mental health, is about functioning in society.
Well, I agree with you that there are times for everybody when they really need somebody impartial to talk to. Like, you can't really tell your mom, I'm feeling sad. My mom would have said, oh, don't be sad, cheer up. Maybe it's something she's doing that I can't talk to anybody else about. So I do think that there is a real serious place for this. And Dr. Mian, did you have a comment on this?
Well, I mean, I think, Kelly, what you guys are doing is great. But the question I did have is, do you guys have like health coaches or whatnot to sometimes help guide?
Yeah, of course. So we have some psychologists that we refer to directly that work with us. And then all of our instructors who teach courses are trained by the National Council for Behavioral Health. So it is a standardized curriculum that we teach. And yeah, it definitely is challenging. The people that we train become brain allies, what we like to call them. So they're community members that have more information than the general public. But it definitely is tricky finding the right people to refer out. And then once we do refer people out, will those individuals actually seek the treatment that they need and follow through? You can lead a horse to water. Will they drink? But, you know, it takes a constant effort, and the first step is just normalizing it. Like, it's normal to get help.
The Global Health Network's mission, right, is to normalize, you know, taking steps to make sure that you're the optimum person you can be. And so aside from providing these tools, do you do any external messaging and any PR around these principles?
Yeah, so a lot of the work that we do is on Instagram. We do shared lives with psychologists, authors of mental health related books. And then on a constant basis, we're posting information about mental health. So, you know, we have to lead with information. The more people know, the better suited they are to help. And also that's how we destigmatize the topic. Stigma is a pervasive barrier that prevents individuals from engaging in mental health care. So when we correct these misconceptions that are negative, then we can encourage people to get help.
So how are you going to measure the success of your project? And have you had any cases that you would consider your project has been successful in making a difference?
Yeah, it's the little things for sure. We have people message us all the time that ask for help or personal stories. And I've even seen people that I know that are reaching out to the account, not necessarily knowing that, you know, I'm hands-on with it. And so that really makes me feel good that those people are being touched by this. But honestly, there's no way to measure it. We just have to keep going, and we'll be yes people for anything that we're asked to do. Our biggest win to date was we did a whole school district. We did kits for them. And I love that, because if a teacher announces that she has a mental health first aid kit, maybe those students would feel comfortable confiding in that teacher or, you know, acknowledge it.
Yeah, so we have our iHeart Media Maven, who is a marketing genius here, Kenya. Kenya, do you have any ideas or comments about this?
Yeah, I was just going to say, you know, what I think is great about what you're doing is obviously the education piece, but I have a question about how you are positioning what you do with families, right? So I think sometimes we think about the individual, right, and the person who's actually going through, you know, or experiencing a mental health issue, but there's the family that oftentimes is on the forefront of it. So what type of services or programs do you have in place to educate family members on things to look for or how to identify, you know, if someone is experiencing or having a mental health issue?
Absolutely. I mean, so many people are caretaking for individuals with mental health issues for no money, and it's a full-time job. So our course is bystander intervention. So it's training how to identify in other people, as well as self-care. But, you know, through the course, we talk about the signs and symptoms. We talk about the risk factors. And I would say the biggest thing that we tell caretakers is that everyone has to participate in their own mental health recovery. So, you know, the biggest thing, do not threaten to withdraw care. Continue to love them. Don't take things personally. Continue to show support and leave the door open. If they don't want help, they don't want to talk to a stranger or see a therapist, then you let them know, okay, well, when you're ready, I will be the person that will help you. I will call, I'll give them your insurance, and to just be really hands-on. One of the symptoms of mental health issues is that you don't want to do anything, nonetheless, call and make an appointment. So make that appointment for them. You know, show them the same kind of compassion, love, and care that you would if someone was in the hospital with a torn ACL. So whatever it is, go above and beyond and just show consistent love and support.
No, that's really great advice. Do you make a difference between people who have a type of dementia or Alzheimer's versus younger people who are, you know, experiencing, you know,
Suicidal thoughts
or other emotional issues?
Right. So our course doesn't necessarily cover dementia. However, we do reference it a bit because dementia is as chemical in the brain as it is with a mental health issue. So we do kind of use that example to show people that it's not something you can snap out of. It's as natural of a human, you know, function as dementia would be. Like, you can't just tell someone with Alzheimer's to remember. And in the same way, you can't tell someone with mental health issues to get over it. But I would say most of the values of the course still would apply to caretaking for someone with dementia as well.
So do you think that mental health issues are environmental or chemical or probably both, right?
Yeah, so I mean, there's a lot of risk factors or things that cause mental health issues. Genetics is a big one, but there's still so much that we don't know about the brain to pinpoint the specific cause. Trauma, difficult childhood, ongoing stress for extended periods of time. So there's many contributing factors, and as much as we can try to figure out what caused it in a certain person, the point at hand is to just get them help.
To lead off that point is, toxins, medications, sometimes things that we're surrounded by or things we take on a daily basis can also cause those problems that she's mentioning too as well. So being able to talk to somebody about those things is really important. So there are interventions that need to be done. Sometimes the interventions can be a little bit more simpler. And with dementia, obviously, it's a long chronic thing that goes on and on. So just having that continuous care, we deal with that all the time where, caregivers really need that kind of that support where they need to be able to deal with their parents or whatnot, because it's a difficult situation.
Thank you very much. We fully support your effort and that you succeed in your mission in making
Absolutely.
Mental health a priority for society and insurance companies and all the other stakeholders. And
Yeah, I'd just like to say we all feel the tragedy of a young person killing themselves. And if you can prevent one suicide, then you've done an amazing job.
Thank you. That's the goal.
You're absolutely welcome. Kelly, where can people find you again?
So mhgn.org.
Great. You're listening to Passage to Profit with Richard and Elizabeth Gerhardt. We'll be right back after this announcement. Well, welcome back, everybody. You're listening to Passage to Profit this evening with Richard and Elizabeth Gerhardt. And Kenya Gibson now is going to present us with her segment, Cultivate. So Kenya, what's on the agenda for this Cultivate session?
Yeah, so it's interestingly enough, we've been talking about neuro wellness, we've been talking about mental health, and I feel like it all kind of comes together with who we're going to talk about today, which is Kanye West. So, he's back in the news as usual Kanye does. He has these spurts and these outbursts that definitely make us question his mental well-being. But what I will say about Kanye without diluting him too much, because obviously there's something very serious that's going on there that we should definitely all be paying attention to. And I hope that his family members are paying attention to that, is he is quite the creative genius. And one of the reasons why I thought he was good to talk about today, not just because he's trending, but he's really also been one of those great contributors to the culture, whether you take it in a negative or you take it in a positive way, right? He's always found a way to market himself very well. He recently did a deal with the Gap for his Yeezy collection. And I don't know if many people know this about Kanye West, but Kanye West used to work for the Gap. It was one of his first jobs in retail back before he was who he is today. So interestingly enough, full circle, it's come around and he has struck this gazillion-dollar deal with the Gap. And what I noticed yesterday is he had threatened to pull away from that deal and stocks actually shot down, which makes me think there may not be as much of a negative perception about what he portrays in the media as people may be perceiving, right? Because you look at the deal, you see, oh, maybe if he pulls away, it's probably a better, brand image for the Gap. But in hindsight, investors see that it's problematic. So it made me think a little bit of just about who he is as a person, what he's been bringing to the table as far as, controversy, but how he's been very good at using that and flipping it on its head to really kind of create these moments for himself in marketing, which I think is a little bit of creative genius.
Yeah, I would agree with that. And so you're in the entertainment business, and so you understand that a huge part of entertainment is drawing attention to yourself. And there are some people who just seem to have that knack. And it's usually, quite honestly, some of the most outrageous people, but they keep themselves in the press by being constantly controversial, right? And that's the game. So I think just looking at the way he talks, there does seem to be something that is a little different about him chemically, maybe, than other people, but he is obviously able to capitalize on his ability to keep himself constantly in the news.
But honestly, I feel like he went a little too far this time. I don't feel like all exposure is good exposure. And having your adult child here that you never wanted them is really horrible. And
Oh, wow.
I don't know.
I agree 1,000%. I think, again, I think that's where the whole mental, wellness comes into play, right? Because I think cognitively, obviously something's going on there, because judgment-wise, he doesn't always make the best judgments when he makes certain statements. I will say, though, the fact that he's managed to align himself with one of the world's most famous families, right, and really kind of took his career, which became dismal at one time, and resurrected it, by leveraging their platforms and everything that he's done in the fashion, lane, says a lot about the fact that he's kind of brilliant, right? And he definitely has something going on. But at the same side, he's really good at leveraging that creativity. I just hope for Kanye's sake that, he has people around him that love him enough to, get the help that he needs. Because I think, if you're able to kind of clean all that up and round it out, you have a pretty substantial human being there that could be a real great contributor if he learns how to do it in a positive way.
Yeah, but going back to the comment about his kid, whether that was the chemical side of his brain talking or it was the self-promotion side, you have to be an intensely selfish person to say something like that in public about a family member, right? And so, and I've never met him, I don't know him, but to say something like that, because when he's saying that, he has to know what's going to happen. He's experienced enough. He knows that that's going to generate controversy. And so if he is a genius, he knows what he's saying. But to put his family well-being at risk for a few minutes of fame, to me, is very disturbing.
I wonder though, from the mental health aspect of things though, is it coming from a place of somebody being emotionally caught up in the moment and wanting to be expressive, or is it a real, what we call in the culture, a clout chase, right? So it's interesting because you see these videos, you see these clips, you see how emotional he becomes, right? I don't know, and I think there's people who can fake that, but at the same time, I think, and I'm not a doctor, and Dr. Mian, you can correct me if I'm kind of jumping out the window here a little bit, but I think he comes from a very passionate place, and sometimes, that gets misconstrued. Not to take away from the fact that you should be responsible and you should not be making. I mean, he's made a lot of other statements too that have been like way out the window. That I'm like, okay, someone should have pulled the plug on him a long time ago. But I think for the most part, he comes from a humanistic place where I think he gets caught up in his emotions and he's in the moment, and then things come out and then it's like, oh God, how do I take that back? It could be the case, it could be not, but.
Well, I was going to say, I kind of wonder if he gets caught up in the moment, or some of this, like you were saying, is that some of this contrived too as well, because you see people in the media just, whether their whole family, there are multiple people involved in doing something and saying something outlandish or outrageous. Is that part of it, in addition to what you were saying, or he is an emotional guy, as you've seen in the past and other videos?
Connected with Kardashians, right? So
Anything
I mean,
goes.
that is the very definition of popular dysfunction, right? So, so who knows? You don't know.
So on that note, I guess we'll find out. But
we'll find out. Stay tuned.
But you're right, Kenya. Like, this show is about entrepreneurs and intellectual property, and his branding is through the roof and his marketing is through the roof. And, I wish I could get my business like that. So I don't think I'm going to say
I'm not willing to be like him. I'm sorry.
Well, no, I'm not.
Without the
drama.
The other stuff.
Yeah. So speaking of things that are working well, So I'm going to talk a little bit about Fireside just for a minute. So I do want to say it's kind of funny because the remaining speakers with Dr. Mian, Heidi, and Heather have all done interviews with me for Fireside. And I think I posted Heidi's, but I have to finish processing the other two. It's moving along. I'm getting new interviews every week, and I filed my LLC, and I'm getting ready to prepare my other documents, and I'm kind of figuring out now some of the aspects of how the infrastructure is going to work and intellectual property ownership and all that stuff. So it's plugging along, and I'm just having so much fun talking to people and doing these interviews. There's so many great businesses and smart people out there. So having the time of my life, even with COVID. So our next presenter is somebody I met at a networking thing. She has a really intense story. I'm not going to spoil it by saying anything about it. Her name is Heather Kavaternick. So welcome, Heather. So give us your 2 minutes and tell us your story.
By trade, I'm a master esthetician, and I have been for 30 years. And as part of that, I was also a makeup artist. It goes kind of hand in hand, skincare and makeup. But about 10 years ago, almost exactly 10 years ago in August, through the result of my own trauma, I became my own client. And what I mean by that is I survived a very violent attack by a stalker. He left me for dead. The doctors don't know why I survived. I should have lost this eye. I have scars on my face that I had to heal. Not to mention the mental trauma. I was diagnosed with severe PTSD, and along with that goes depression and anxiety and a lot of other things. And I had two choices. I could either do what most people said they would have done and just kind of lay down and play dead and just go on disability the rest of their life. And I couldn't do that. God had kept me alive for a reason. And I embraced that, and I embraced the reason, and I saw what I was able to do with my own face, my own scars, and my own changed mental health, my own self-image, which is a huge part of it because it's not just scars. And as a result of that, I have a skincare and a makeup line, and the makeup line is also skincare that I can cover. I can help any woman to not only accept who she is, but also to play up the features she has and play down the features that she wants to play up, and play down the features she wants to hide or draw attention away from. And I do it all with color and different coverage formulas, and it's also very active, so it's very healing.
Right. So you've covered your own scars. That's where you started, right? Was you had
Yes.
You looked in the mirror and you said, I am not going to let this guy destroy my life. I'm taking my life back, and I'm going to do something with what he did to me and make my life even better. Right.
Yes.
And
Yes.
got you on this path with the whole special makeup to cover scars and imperfections. And you look beautiful. Like you.
I was going to say, you are beautiful, lady.
Oh, thank you.
Skincare thing, but you're very customized, right? And you are doing things remotely with COVID now, right?
I'm very customized. I custom blend everything I do as far as the makeup. The colors are behind me, and the actives and whatnot. And I customize it from scratch. So literally I can look at all y'all's skin tones. It was really easy when I had a brick and mortar up until a few months ago when the quarantine set in, and my industry in my state, Virginia, is still shut down. I can't take clients. So I had to shift, or I had to just lose my business. So I shifted. So I can look at y'all's skin, and I have been, because that's what I do. And I can custom blend entirely to either match your skin, color correct your skin, and then we would get more personal with what kind of coverage you want. I can cover a port wine stain. I can color match to blend away vitiligo. I can cover a tattoo. So yeah, we completely customize it to there's no we, to what you need. And as a woman, it's not even just the skin conditions or the scars. I have so many women say, well, I just hate my blotchiness or my surface veins and capillary. They think it's veins, it's capillaries, or my sun damage. And so it really comes down to self-image. And I take the challenge, and I can do pretty much anybody's face.
Heather, are you seeing people virtually now?
I am.
You are, okay. So have you ever thought of writing a book or sharing your story that way?
I have, and I am, and it's just a matter of, I wear so many hats. I'm also raising my toddler grand princess. She'll be 2 years in just a couple months. I wear so many hats right now that my book somehow always gets pushed to the back. However, my story, I have learned, and it's been painful, but I've learned to embrace it. And that's how I relate to my clients. It's no longer a matter of, well, Heather, you're beautiful, so you wouldn't understand. It's no, I have scars I can show you, and they then know that I do understand. And I always lead with compassion.
So, Heather, how did you learn to embrace your story?
Wow. How did it really boils down to the fact that I know that God kept me alive to make a difference for other women. So, and there have been times it's been hard, and there have been times over the years where I've wanted to just say, forget it, and lay down and play dead and just not do it. And then God sends me a woman who needs me. And he's like, Heather, and that's why you're here. So I had to learn to embrace my story. And part of my story, you'll see part of my story on my blog, and bits and pieces here and there. I talk about it in lives and whatnot. But the day will come, yes, Kenya, that I will have my story published.
Do you still struggle with this every day?
No.
That's good.
I still struggle with it on bad days, but I don't struggle with it the way I used to. It's been a full 10 years. August 27th will be 10 years.
My God.
There was a 6-month, 9-month time in my life where I wouldn't even get out of bed. It's not that anymore. And when I am struggling, I've learned to meditate. I've learned to shut down everything Dr. Mian was saying about sleep and shutting things. I've learned to do that. Not even just sleeping during the day, to unplug from all of the overstimulation that might trigger me. There are triggers. So I've learned mental health tricks. I wish she was still on too. I've learned a lot of mental health tricks to help me cope so that it's not an everyday struggle. And I do not have full-fledged flashbacks anymore. It's been at least 3 years.
I was just saying, I mean, that's great. I mean, being able to work through that, I mean, that's absolutely tremendous. And your stories, is a very powerful thing. So once you get that book out, I think it's going to be very inspirational for a lot of women. And what you're doing, I think, is absolutely fantastic. And it's absolutely wonderful. So it's really, really great to hear that you've been able to overcome this.
Mm-hmm. And heal. I think what's powerful is because we talked in the beginning with Dr. Mian about like the body's ability to heal itself, right? So, and that's all different facets, like physically, spiritually, so it's like, your story is like, encompasses all of that. So
It does.
Yeah, and there's a couple different things I think that are really highlighted with you. One is you truly were a victim, like as victimized, I think, almost as a person could possibly be. But you turned that around to be not only a survivor, but a conqueror, right? Like, dang, girl. The other piece of that is that society is so visual and women are so judged on appearance that we really do need what you have. And, it's hard to find good makeup. And you do the skincare part too, because I've told you, like, my makeup doesn't look good on me. And you're like, well, that's because your skincare part isn't right. Right. So whole package together. And then a person can look like radiant, right?
Exactly. Yes. That's what I'm all about. Embracing your unique beauty. It's not about trying to be somebody else. It's about embracing who you are, your scars, everything else, and making the best of it and presenting that to the world with confidence.
And what is the name of your company?
Holistically Beautiful. And it's with a W. It's not HOL. It's the traditional real spelling of holistically.
Oh, like whole.
Yes.
Okay.
Yes.
Nice.
Holistically Beautiful. And then holisticallybeautiful.com. And I have a Facebook
I hope you
as well.
trademark that holistically.
I hadn't thought of that. I need
You
to.
should.
Yeah.
You're talking to the right guy.
Okay, well, there you go.
So you are able to analyze people remotely. So you can do sessions with people on Zoom and ask them questions and figure out what they need. And then when quarantine's over, people can come and see you in Virginia, right? If they want.
We're working on that. I'm visioning my brick and mortar. I've chosen it. I'm visioning it into reality. And I told Elizabeth when she interviewed me that in January is my projected opening date. So I'm hoping she'll come visit me then, but I'll keep you posted.
So you're doing the virtual consults. Are you doing it? Do you do any like tutorials? Are you teaching people too, like about application? Because I feel like that is like the biggest thing with people. Like you can give people the best products, but if they don't know how to work with it, it's becomes trivial.
I want to say yes. I'm working on it. I did my first skincare tutorial the other night on Zoom actually. I go back 30 years as an esthetician, master esthetician, and everything was brick and mortar. I knew nothing about computers. So I actually signed up for a course to teach me how to do all that, and I'm learning. So yes, that is the plan, and I'm fast tracking it.
Wonderful. Well, unfortunately, we've come to the end of our time, but I just am blown away by you, Heather, honestly, and by our next presenter as well. Like, this has just been such an amazing show. So you are listening to WR 710, iHeartRadio, the voice of New York, Richard and Elizabeth Gearhart, and our special guest, Dr. Fawad Mian, and we'll be right back.
Welcome back to Passage to Profit, everybody. Our final presenter this evening is Heidi Rome, and from the company Mom Spectrum Oasis. So Heidi, you have 2 minutes.
Thank you so much for having me. It's a pleasure to be here, and especially to follow your prior guest, Heather. I was so impressed. In terms of survival and coming out the other side, because my story is very similar. I am an autism mom coach, the author of You Just Have to Love Me, Mothering Instructions for My Autistic Child, because my story is that with the diagnosis of my younger son, Ethan, who's now 14, with autism when he was under 2, my life changed, and it was a very hard, difficult journey. And so much of the pain of the diagnosis was everything emotionally, and the change in the story, the change in the script of what should have been the dream, the future relationship you envision with your perfect child, and then to have the rug pulled out from under you, and suddenly you're on another planet, and it's pretty horrible terrain. So you have to adapt. So it's been a tough journey. I've learned a tremendous amount as far as logistically and detail, and speaking with every doctor and speaking with the teachers and looking at every emotional, that too, educational approach, medical therapeutic approaches, everything. And it's been a long journey with Ethan, who has severe autism. This is not what is often portrayed in the media, you know, the good doctor and the surgeon and the brilliant people and Einstein and Van Gogh and all these people who you hear, oh, I think they were on the spectrum. My son is on the other side of the spectrum. Nonverbal, dysregulated behaviors, it's very difficult to be with him. However, you said, what kept you going? And for me, it was a change in the story that was pretty profound. One of the blessings of my son's prior schools was that they offered something called facilitated communication, which is a spelling to communicate technique using it. The teacher is providing pressure to resist, the child or the person has to resist someone's hand so that it helps the brain sync up with the hand. Oh, there's my hand, and access the intentionality of what to express. Similar to when you pick up a pen, you may not know every word that's about to come out of your hand, but you're syncing your brain with the communication center. Okay, we're going to provide the environment for that to happen. So this technique empowered that in Ethan, and a child who I had taken him all over New York and, you know, getting him tested. And when he was 5 years old, it came out that the testing said that intellectually he was so disabled, he was at the level of a 5-month-old child. And I cried for a week after that. It was a horrible time. This was a kid who you really thought was very profoundly impacted intellectually. Through the typing, however, we saw that there was this profound intellect that was locked into Ethan, and he was typing incredible things. And this one conversation, and Elizabeth has heard the whole thing, but in this conversation, Ethan describes his experience of his own autism as a spiritual journey. And in that communication in which I just said to him, you know, I never asked you your thoughts about God. He said, he typed, God is in my heart and will always protect me. Well, did he tell you that? Yes, when I lived in heaven, he told me that. I remember a time without bodies. In heaven, there are no bodies, just spectacular energy. And he went on to say that we were family before and that he chose to come here and have many challenges. And when I said, why? I will be greatly rewarded in eternity. And ultimately, when I said to him, what can we do to help you on the journey? His first response was, I have to fulfill my journey as prescribed by God. But that wasn't good enough because I'm his mother. But what can we do to help you on your journey? You just have to love me, and that is your job. The rest is my job to do.
Wow.
And with those words, Ethan gave me, gave every autism mom, gave every mother, every father, every parent. He took us off the hook because now our job was not to fix him, change him, heal him. Oh my God, running around literally anywhere, following any shiny object. You might help my son. You might help my son. You might help my son. I stepped back and I said, how can I love him? And I looked at that. It wasn't about changing him. It was to meet him where he is. What is the definition of love? What do you need? I'm always here for you. No matter what, no matter when, always, no questions asked, I'm here. That is the definition of love. It's how God defines his own name in the Bible. It's how, you know, love is love is love. Love is the matrix of all reality. And what I now guide moms, I learned all the practical stuff, very practical advice. But emotionally, what's your North Star? When you don't know what to do with your child, with anyone in your life, what do I do right now? Choose not to act from the reactive fear place. Choose love. What would love look like right now? What do you need right now? How can I love you right now? And often, how can I love myself right now? Because this is a critical piece of this journey. It's so easy for us parents. It's all about the child. Never mind me. Well, wait. You need to, it's love thy neighbor as thyself. And we know medically, the doctor I hope will corroborate, the heart actually pumps blood to itself first before it pumps blood out to the rest of the body, because it must be oxygenated and nourished and strong so that it can do its job and feed 37 trillion cells of your body. It has to be strong first. So I guide moms, love you, be that role model for your child. It's in loving and nourishing and protecting and honoring yourself that you love and nourish and honor and protect your child, because your child sees all that in you.
Absolutely, Heidi. And I just love talking to you because I felt so much better. Like, oh, wow. All those screw ups I did, well, it's probably okay. My kids turned out great anyway. So I want to give the floor to other people too, and I have already spoken. So
I would just say what a powerful testament, you know, from a child, because, and I think we can learn a lot from children, right? I think they're the most authentic and transparent beings here, right? Because they always tell the truth about everything. So when it comes from a child, it just, I feel like it comes from a different place. And I just want to just, you know, say how impressed I am that you were able, as a mom, because I'm a mom, right? I have 2 kids, to take something that, you know, positioned itself as a hindrance to your child and really turned it around to positively impact other people. I think it's not always easy to do that. So I just wanted to say I admire that, because I don't know that I would have had the same strength to do something like that.
Yeah, the experience must
Thank
have been
you.
so freeing, you know, to find faith and have the message come from your child, almost, Mom, don't worry about me, I'll be fine, you know, and just love me. And how difficult being a parent is already, but with also the extra challenges of autism, and to have that freedom now we're so glad that you've written a book and shared this story with other people so that hopefully they can come to the same place that you have.
Thank you so much. Well, one of the things that I do, and the other guests have talked to this, the power of your own mind, to look at your own beliefs around something, because that's often where the suffering is, that the autism is the autism, the challenge is the challenge, but we distinguish between what that is and the emotional response to the challenge. If you look at autism and you say you believe the societal narrative, it's a tragedy, this is awful, this is terrible, fix it. And your job, mom, by the way, good mother, is to fix it and make it go away. If you question that, you say, wait a second, let me step back. Who says that? Who is telling me that? Whose message is that? What if it's not a tragedy? What if I choose through love to view it as a challenge, as an opportunity, as a way to demonstrate who will I be in the face of a challenge? Will I be a puddle on the floor? Or will I be that conqueror? Will I be that mama bear? Will I be the one who says, I will find a way? And this is an opportunity then, because yes, it is very challenging every moment of every day, but I get to choose who I am. And if I'm the hero of my own journey, I will have a different life experience than if I choose otherwise.
It's also a very powerful story. And just to jump on what you're saying, Heidi, we are, sometimes can be prisoners of our own beliefs. So if we already have that hyper-focused narrative, we can't think outside of the box. And as you said, loving yourself and loving your son, that's so mentally freeing. And it's all that negative body chemistry, all that stress that you have on yourself and around the environment from which your child is being brought up in. It makes things really different, and it makes things so much better around you. And
exactly. When I calm down, Ethan calmed down. And I witnessed that. I mean, very dramatically. Not that he doesn't have stuff, not that things don't still happen, drastically better because he feels it. There's a spiritual umbilical cord with a child, even if you didn't give birth. It's a spiritual heart connection. We feel it, right? They can't just say, oh, everything, when you're lying, I'm fine. No, come on. The kid knows everything. The kid feels everything. When you really are taking your power back and breathing, the child will feel that and say, mom's got it, I'm good. And he'll feel better too, he or she.
And your mom's Spectrum Oasis is really to help other mothers with children that have issues or difficulties and to really make them feel better about themselves and give them a support group. Is that right?
Yes, I do work one-on-one when people want to do more of the deep dive and what's going on with you and your situation, and also with group, because group is a different dynamic. And part of what happens with autism or any fear thing that triggers fear is that we isolate, and we become socially isolated, and we think we're the only ones who feel all this hard stuff and no one else understands. And the power of a community, a tribe, so to speak, is we gotcha. You need a hug, you get a hug, and then in the next second you're hugging somebody else because they need a hug. And, you realize you're not alone and you're very human and you're there to help each other. So that, yes, to answer you, there's a different dynamic that happens in a group. It's very healing.
Well, when I first spoke to you years ago, you told me that everybody focuses on the child and nobody focuses on the parents, and especially oftentimes it falls to the mother. And so that was one of the things that you wanted to change. You wanted to give mothers permission to have attention around this topic too.
Yes, exactly. Well, because usually it's mom who's the captain of the ship and guiding everything, and she is running the team, and it takes a village to raise a child with any special need, certainly autism. And so there are so many services out there for the kids, rightly so, but yet it's like, who's in that waiting room? She's bringing, as I was dragging Ethan to, dozens of appointments a week. And then the mom is in the room and she's collapsing, and I saw that. And I was, I'm like, I wanted to become the resource I had not had. And I wanted to say to her, you're not alone. It'll be okay. Come on, hang in there. And how can I help? And do you just need someone to listen and, just to hear you? So yeah, that was part of what I wanted, to be that resource for moms, to give her what she needed so that her own life wasn't now devoid of purpose and joy, which is what it can feel like if you're still in the tragedy narrative. It's a very dark place.
I think you kind of have, you said it all.
I would agree with that too. I think it's pretty well said.
Yeah.
Well, thank you. I guess part of the message is that it's a message for all parents, and actually in any loving relationship, think twice if you're thinking you need to change somebody. That's not going to be the path to a healthy relationship. Honor them where they are, meet them where they are, presume competence, assume everyone understands everything, never think someone is not listening or not caring or not aware. Assume they hear it all, and give every human being the dignity that they're worthy of, as just being a human being.
And so Heidi, where can people reach you again?
You can go to my website, Mom's Spectrum Oasis. You can get my book, You Just Have to Love Me, on Amazon. And you can set up a call with me if you would like to just speak with me. Go to bit.ly, callwithheidi.com.
Well, one thing that this your child has taught you is he's given you great wisdom, and we're grateful that you're able to share it with us here on Passage to Profit. Unfortunately, we have to take a break, but we'll be right back after this message. Well, welcome back, everyone. A very powerful show this evening, I thought, and absolutely fantastic guests and very deep on a lot of issues.
Very deep. Just shows the courage and survival of the human spirit, and how we take lemons and make lemonade like everybody's doing during COVID, right? I mean, it's amazing what people can do. It's just like, it blows me away. And my problems seem minor compared to when I talk to other people.
Before we go, Dr. Mian, do you have any final words of wisdom for our audience?
Well, I just want to say thank you for, again, on the show. I think a lot of the stories that we heard today were very powerful. And, we just take, some lessons from that. The power of the mind is a very strong thing, and it affects and permeates everything in our body to a relationship that are around us. So it's always very important to make sure that we have positive thoughts in everybody that we interact with and everybody else, because that's going to help your overall health in the long run.
Great. Kenya?
No, I just want to say I felt like this show and this conversation just blended together so well with everybody who came on here today. It was a lot of synergy, for lack of better words. So I just wanted to say I really enjoyed hearing everyone's story, and everyone just had such a powerful contribution. So I appreciate being a part of the conversation.
We love having you. So I want to reiterate how you can get a hold of everybody. So Kenya, who just spoke, you can reach her at Kenya Gibson with a P, Gibson at iHeartMedia.com. She can help you with any marketing needs. And we have Richard from Gearhart Law, and who patents, trademarks, copyrights. Dr. Fawad Mian at PROLOhealing.com. So he's the guy you go to first before you do anything else if you've got pain, because he can help heal it without drastic measures. Then we had Kelly Marzoli with mentalhealthglobalnetwork.com. She's trying to bring mental health out of the closet, shall we say, and make it online with physical health so people don't feel stigmatized.
I'm going to call her right after the show, by the way.
And then we had Heather Kavaternick with holisticallybeautiful.com, holisticallybeautiful.com. There's a W in it. So she can take a look at you. She can do this remotely, and she'll be doing it in a studio after COVID, and help you not only with your makeup, but with your skincare under your makeup so that you can look your best. And if you've got like some blemish that you really want to hide, she can do that too.
Yeah, she's beautiful inside and out.
Yes, she is. But I love that she can cover up port wine stains, scars, like capillaries, like all that stuff we suffer with and criticize ourselves for. And then we had Heidi Rome, who has written an amazing book. And the name of her book is You Just Have to Love Me, Mothering Instructions from My Autistic Child. And the wisdom that she imparts in that book to everyone is just amazing. We love her. And you can find her at, the name of her company is momsspectrumoasis.com. So MOMS spectrumoasis.com. So I hope that you'll visit everybody's sites.
I feel a little bit more loved after listening to her.
Oh, how sweet.
Thank you. That's great. Perfect.
So you are listening to Passage to Profit, WR 710, another excellent show. Oh, before we sign off, tune in next week because we'll have another great show. I don't know how we top this one, but we always have great shows because of the people that we get. Thank you, guys. Noah Fleischman. I always have to give him a shout out. He is our producer at iHeart. We used to go into the studio. He would record everything on his really high-end equipment and tweak it as we were doing the show. And now he has to take these crummy Zoom videos and take the audio and make it good enough to go on radio in New York. So thank you, Noah, for your magic.
Yeah, we really have to pander to him to make sure he does it good. So anyway, you've been listening to Passage to Profit. Don't forget to like us on Instagram, Twitter, Facebook, and check out our new YouTube channel as well. This is Richard and Elizabeth Gerhardt on WOR 710, the voice of New York.